And we'll go ahead and get started. And if you need your badge scanned, please feel free to do that. As Lee said, he and I work together. We work at a place called the Integrative Life Center. Lee's been in the treatment industry about 20 years now, has opened a number of treatment facilities in California, the Ranch in Nunley, Tennessee, and most recently, about 7 years ago, the Integrative Life Center. And so we have been working together since then. We opened up the Integrative Life Center together and wanted to tell you a little bit about it, maybe toward the end, just so that you know what some of the treatment resources are in the Nashville community. So we are going to be here today, and this is a long day for you guys, I'm sure. And this was from a movie. I don't know if anybody remembers this movie or not. Yeah. And so one of the things, as Lee said, having you come up, please feel free to make this a dialogue. And there's a lot of information in here that may be a little bit dry information. When I looked up and looked at the requirements for the training that you need to have for your license renewal, around chemical dependency, I wanted to put something together that would be meaningful and give you some information. But at the same time, what we may do is we may share bits and pieces of our story. And can I talk about you while you're here?
Yeah.
Can I have permission to do that?
People talk about me a lot.
Yeah, people do talk about him a lot. But what I want to do is talk with you a little bit about chemical dependency addiction from a little bit of a different perspective, perhaps. I've been in this field since, 1978. Started working with juvenile delinquent kids and went back to graduate school and have been in the field a little over 30 years now. Have worked predominantly in the drug and alcohol addiction field. Why? Don't ask me, I don't know. But I've always just found it fascinating. And over the years, being able to work and see the changes that have happened in our industry and the changes that have happened in the identification of addiction and how we look at alcoholics and addicts has been very exciting for me, particularly in the last several years when we really started looking at the brain. And we'll talk a little bit about addiction as a brain disorder as opposed to the specific drugs. I have been sober for 25 years now, and so thank you. And I only know that just because it kind of gets etched in your brain, that pivotal day when you make that decision that you've had enough. And so what I'd like to do as we talk about this, I'll share bits and pieces of my story with you if that's okay. I have 4 children in our family, 3 girls and 1 boy. All 3 of the females in our family are addicts, alcoholics, fortunately all in recovery now. So as my sister once said, our family tree was watered with alcohol rather than water. So there is a genetic predisposition to that, as most of us know. So, and I will also ask Lee to share bits and pieces of his story as well. He also went through treatment, drug and alcohol treatment. It was one of the things that interested him in getting into the field to begin with, and from a little bit of a different perspective of really looking at what was helpful to people and what was not so helpful to people. And so what we wanted to do 7 years ago when we opened up Integrative Life Center was to open a center that truly looked at the person and looked at the individual and said, what happened in your life that created these circumstances, and let's find a way for you to change that and create a life that really you deserve to live. Because we all deserve to live a life where we have joy and happiness and sadness and everything in between. So when we looked at the time frame here, it was like, what the hell? 5 o'clock in the afternoon? Because if you go to one of our conferences, you're not going to see a whole lot of people at 5 o'clock in the afternoon. So we appreciate you guys being here. But it's usually happy hour between 5 and 7, so
Yeah, but when you go to an addictions conference at 5 o'clock, they usually don't all go to the bar. They all go to the pool, or I don't know where they go, but they disappear. I was just in LA for 4 days for a conference.
we all
Got back
isolate.
late last night.
Yeah, we all isolate, go to our rooms.
Yeah.
So one of the reasons that we're here is that nearly 23 million Americans, and that's almost 1 in 10. So you look at the number of people in this room, and if you look at that statistic, 1 in 10, we probably have 4 or 5 folks who have an addiction to alcohol or other drugs. 2 of us are covered up here. I don't know where the other 3 of you guys are, so we're not going to ask you to self-disclose unless you want to. What we also know is that, the days of somebody just coming in as a plain alcoholic, it's almost non-existent. And usually about 3/4 of the people that come in, or 2/3 of the people that come in for treatment or are surveyed, about 2/3 of them are using alcohol in addition to other substances. This is a statistic that we read about in the newspapers. We hear about it on the news, and people are just getting really alarmed. But we have nearly 15,000 people who die every year of overdoses involving prescription pain medications. One of the reasons why dentists, doctors, therapists, why we all need to take these courses to be able to identify how we can prevent that from happening. It's interesting that this epidemic of opiate addiction is now coming to the forefront because we now have middle class and upper socioeconomic status young people dying from this disease, but people have been dying from overdoses for a long time. So I'm glad, whatever the reasons why, that we're bringing this to the forefront again. So there's been more than a 500% increase in the treatment of addiction to prescription pain medications. In a 10-year period of time, 500%. And at any given time in a treatment center, probably at least 50%, if not 60 to 70% of the folks in there have been using prescription pain medications. Threefold increase in accidental overdoses between the 90s and 2007. And this last one kind of blew me away, that enough prescription painkillers have been prescribed in 2010 to medicate every American for at least a month. Think about that.
So that, you guys, is a cultural epidemic. It's not an issue with the individuals that are just carrying that are having the scripts written to them. It's reflective of our entire culture and the nature of the culture that we live in.
Mm-hmm. And prescription pain medications, one of my sisters, she's just a year older than I am, and she has given me permission. Any stories that I share with you, I've asked folks for their permission to share that, because it's not my story to tell. It's their story to tell. But I have a sister, and her drug of choice was pain medication. And she was a master at being able to find doctors, dentists, veterinarians to give her pain medications. Her vet would prescribe, she would go and talk about her dog and how nervous her dog was in thunderstorms and things like that, and the vet gave her Valium for her dog. So there are all kinds of ways, and we'll talk a little bit about that at the end, about doctor shopping and how we get that. So why are we here? And these statistics are about dentists. I know everybody in here perhaps is not a dentist, but in the dental field, is that correct? So I'm not sure, how the statistics translate to dental assistants and things like that. But one of the things that we know is the suicide rate of dentists is more than twice the rate of the general population. And when I was talking with a friend of mine about that, she said, well, wouldn't you be suicidal if you looked in somebody's mouth all day long? And I thought to myself, well, that's an interesting question, because it never occurred to me to think about that, because when you love what you do, then, we just don't think about things like that. But it was interesting to me, and then looking at kind of the reasons that contributed to the higher suicide rates, in that, the stress of a practice these days, the stress of insurance reimbursement, oftentimes income is going down, isolation, you're working with people in pain all the time. We know what that's like, working with people in pain. Things like that are, contribute to job dissatisfaction, which then contributes to suicide rates. Emotional illness ranks third in the order of frequency of health problems among dentists, while in the general population it ranks 10th. Okay? And again, some of that, when we look at personality types that are attracted to certain fields, that can explain some of it. But again, job conditions are the things that often contribute to the mental health aspect of any of our jobs, really. When you look at somebody who works on a factory line, or somebody who works at night and, doesn't see the daylight, or things like that, all of those things contribute to health problems, both physical and mental health. Coronary disease and high blood pressure are over 25% more prevalent among dentists than the general population. Psychoneurotic disorders are higher, and the number one killer of dentists is stress-related cardiovascular disease. So it's not addiction, and there are some statistics out there that some say that the rate of addiction among dentists is a little bit higher than the general population. I read other statistics said that there's not a significant difference in the rate of addiction among dentists. But the dental profession in our country loses the numerical equivalent of one large dental school class each year. So think about that, the number of folks that you graduate with each year. Those, a classroom size of folks are going to die from some health-related problem. So on the average, and one of the reasons I'm going to focus more on pain medication for a minute, because you're not prescribing marijuana, at least in the state of Tennessee. You're not. I don't think you're prescribing marijuana, but opiates and benzos are probably the two medications in the dental profession that patients come in if they are seeking something. It's going to be one or both of those. And so looking at the opiate statistics, the prescription rates, again, are beginning to decrease. And what's happening with the national registries is that as physicians and health professionals are able to tap into the databases and see, people who are getting medications from different folks, what we're seeing is perhaps a decrease in the prescription pain medication, but there's been a significant increase in heroin use. And again, that's across socioeconomic status. It's not just, people in poverty or, young people, although the majority are young adults.
The majority of overdose deaths related to opiate and heroin addiction are people from 40 to 50 years old. It's not kids. It's adults. But it doesn't have the shock power that 18-year-olds being found dead in their bedroom at home has. So it's not talked about. But by far the largest segment of overdose deaths in this opiate epidemic is 40 to 50-year-olds.
Mm-hmm. And which is interesting, because the majority of folks that are in treatment for opiate use is that young adult population. So, it makes sense that if you're not getting help, then you're in trouble. So this was just a partial list of folks, and these are just, well-known folks in entertainment industries of some kind. This doesn't include the neighbor down the street from us, or the child, that our own child. And so when we look at, the number of folks who are dying as a result of any kind of drug overdose, it really is an epidemic, and it's something that is most definitely preventable, again, why education becomes so important. So this is a question that I think, lots of folks ask. Well, if you know that a substance is addictive, why the heck are you going to start using it in the first place? And I love this quote by Anton Chekhov, and he says, "In the search for truth, human beings take 2 steps forward and 1 step back. Suffering, mistakes, and weariness of life thrust them back, but the thrust for truth and stubborn will drive them forward. And who knows, perhaps they will reach the real truth at last." And this is what we hear over and over and over again, that yes, somebody may have physical pain, but the continued use really does have a lot to do with the psycho-emotional pain that somebody is going through. And I have a little video clip that I'll show, and talks about the opposite of addiction is connection. And this is a relatively recent concept that we've started talking about connection as an attachment, as addiction as an attachment disorder, or an addiction as a connection problem, as opposed to this person takes this drug and gets addicted. So we recognize that addiction is a chronic disease, okay, and there's still argument in the field. It's so interesting. I was at a conference one time, and there was a panel presentation about, disease, brain disorder, AA, other kinds of therapies, and literally the room was divided. And so still among the professionals who treat addiction, I think everybody, has come to terms with this is a medical condition quite often. But when you look at opiate addiction, it's rare that you will have a hospitalize somebody, admit somebody for an opiate addiction, because it's not considered medically necessary. You're going to be really, really uncomfortable, and throwing up, bone pain, joint pain, muscle pain, but the likelihood of you dying from opiate withdrawal is not very high. Benzos and alcohol, on the other hand, alcohol, legal drug that we have, a person can die from alcohol withdrawal. And so, the person gets high blood pressure, the blood pressure can spike, and the person can stroke out. Seizures are part of alcohol and benzo withdrawal as well. So what we know is that, just as cardiovascular disease damages the heart, diabetes, affects the pancreas, addiction hijacks the brain, literally hijacks the brain. And this is when we start talking about this, a lot of people will want to say, well, the addict or the alcoholic is still responsible for what they do. And yes, I believe that. I believe we all have personal responsibility for the things that we do. But I also know that there are people out there, under the influence of alcohol or other drugs, particularly when the compulsion and the craving to use has gotten to that point where you are using and you have so much shame that's associated with that use, and you are doing things that you would never, ever do when you are not under the influence. And that is probably one of the biggest pieces that keeps people relapsing, going back to using over and over and over again. And it's one of the reasons why in treatment centers, if you are looking for a treatment center for someone, what you want to look for is somebody who's not just addressing the addiction, the drug use, but you want to have a treatment program that's also going to be able to address, the emotional pain and the things that have happened to that person, either, leading up to their drug and alcohol use or in that addiction. It's not uncommon. We have young people that will tell stories, and these are young people. Our center is privately owned, and we don't take public assistance, and so we tend to work with people who have resources. And so I can't tell you the number of times, young people will come into our program, and part of their letting go of the shame and healing that shame that keeps them using is talking about beating up an old man as he goes to the ATM machine, or stealing money from their little sister, or continually lying to their girlfriend, or beginning to pimp out their girlfriend for their drugs. And these, again, this is in a population of people that are professionals as well as unemployed. So, and everything in between. So addiction hijacks the brain, and the brain goes through a series of changes, and beginning with the recognition of pleasure, okay? And all the way from that recognition of pleasure, all the way, to ending up in a compulsive behavior. And if you've ever had any kind of habit, or compulsive behavior, whether it's food, or sex, or shopping, or the internet, phones, and this is one of the things that I think we're in really big trouble, because people can't go anywhere without their phones and checking their phone every couple of seconds, myself included, so I'm not pointing the finger at anybody right there. So addiction is a different state of the brain. Okay, and there are all kinds, thousands and thousands of brain images that have shown us what happens to the brain when the brain is using substances, when the brain has been using substances over a period of time. Daniel Amen, A-M-E-N, is a psychiatrist who has a whole library of brain scans that he has done on a variety of things, but drug and alcohol use is one of them. And included in that, for those of us who are coffee drinkers or caffeine drinkers or smokers with nicotine, and if you see the brain and what happens to the brain when somebody has ingested caffeine and nicotine and over a period of time, it's pretty interesting to see that. So we see that the abnormal or aberrant behavior is a direct result of that brain getting hijacked and the brain beginning to crave. And dopamine, go ahead, Lee.
You see the same patterns with sugar.
Mm-hmm.
You see exactly the same patterns, brain activity patterns, with sugar that you see with cocaine. So if you wonder why you got to have a candy bar, go figure. It's interesting, though, isn't it? And then you look at the nature of what's happened over the last 30 or 40 years with commercial food, and there's sugar in everything. And almost all processed foods have sugar in them today. Mm-hmm. That's not by accident.
Mm-hmm. Yes, you're exactly right. And I can't remember, I think it was McDonald's, a study done on McDonald's and the hamburger buns of McDonald's. And I can't tell you the last time I ate at McDonald's, but I remember when I did, their hamburger buns were sweet. Anybody taste that in a McDonald's hamburger bun? And they do. They put sugar into the bun, and knowing that sugar is an addictive substance that directly impacts the brain, the reward center of the brain. And it's interesting. We were doing a conference one time, a training, and we had put candy bowls out on the tables as well, and somebody in our evaluation said something about us putting candy bowls out and the addictive nature of sugar. And why is it that conferences, will do these things, that for some people is a struggle with that?
Because you guys work in the dental realm, you put out little teeny tiny pieces of sugar. Because it's not good for your teeth, right? But it's also not good for your brain. Sugar's a bizarre substance. Sugar is the primary contributor to inflammation in our system. And almost every disease out there feeds off of inflammation. Inflammation plays a huge factor in our health.
Mm-hmm. So what we see with the brain, three things that manifest, and as we're looking and assessing folks for, is this person, and now with the new DSM-5, which is kind of the Bible that we have to use, unfortunately, to label people with what they have, but substance use disorders for the first time is now it's more a continuum. It used to be people had to meet the criteria for abuse or dependence. And now it's a substance use disorder, alcohol use disorder, opiate use disorder, cannabis use disorder, mild, moderate, or severe. So it's along a spectrum right now. And again, I think that is very true, because we know there are people that can abuse substances. College-age kids being one will abuse substances quite a bit, but then, they may kind of grow out of it, so to speak. There will be other people who abuse substances and they're not able to grow out of it, and then they, move into the moderate and severe category. But what we look for, one of the things with addiction, is that we have a craving. And again, it doesn't matter the substance, and this is why, when the brain research began coming out, for me it was so exciting, because it's not about the substance. And this is one of the things that's really important for our clients and patients to understand, is that it really is about what happens in the brain. And when the brain starts craving, the reward center of the brain gets lit up. There's a flood of dopamine when we engage in anything pleasurable. And again, orgasm, shopping, finding that bag on sale that you have been looking for forever. Food is another one, not just sugar, but food in general. Gambling can trip the reward center of the brain. So we began calling these process addictions because there wasn't a category in the DSM or in psychology to really talk about process or behavioral addictions. But knowing, with this idea that addiction is a brain disorder and it's not about the substance, it makes perfect sense that any activity that we engage in that floods the brain and trips that reward center, it's going to begin to produce cravings. We do that enough and it begins to produce cravings. How many people have been on a diet? Okay. How many people went on one diet and stayed on that one diet and have never had a relapse, never had a problem in their life? Okay, no hands. And so that's kind of what drug and alcohol addiction is like as well. People will make a decision, well, I'm not going to do that anymore. How many of you, when you decided to go on a diet and quit overeating or quit eating carbohydrates or quit eating sugar, how many of you experienced cravings? Exactly, okay? So that's one of the things that we know about, when something has become a compulsive behavior there. The other thing that we begin to look at is loss of control. How many times have people said, I'm not going to eat that cookie? I'm not going to eat that cookie. I'm not going to eat that cookie. Well, maybe I'm just going to have a little pinch of that cookie. Well, maybe I'll just eat half of that cookie. Oh, crap. I'm just going to eat the whole damn thing, and all of a sudden we've eaten 3 cookies before we really even know what we have done. Anybody done the cookie coma thing? Am I the only one? Okay, no, I've got a lot of friends out there. So a loss of control, okay, and again, this is why we know it's about the brain. The loss of control that happens because, trust me, how many of you wanted so desperately on that diet to stay on that diet and lose that weight? How many times for smokers have you wanted to quit smoking, and as soon as the nicotine level drops in your brain, your body, you start going through nicotine withdrawal. You get fidgety, you start, your mouth starts kind of salivating a little bit, and you start thinking about that cigarette, and when is she gonna shut up because I gotta go. And it's usually about 55 minutes or so that the nicotine level in the body starts going down. So you can kind of tell when the smokers start getting fidgety that, you don't even need to have a timer up here to see. So, that loss of control that begins to happen where I don't want to do it, I don't want to do it, I don't want to do it, but the compulsion becomes so strong that I do it anyway. And what we know too is that when we do that, I was a cocaine addict. If you had told me that I would stick needles in my arm to use drugs, I would have told you that you were crazy. I was an athlete. I was an All-American swimmer in high school. I graduated from high school a year early, went to college. You couldn't have convinced me that there would be a time that I would be sticking a needle in my arm. And the compulsion to do that was so strong that, I mean, I can remember even just practicing, okay, because I liked the prick of the skin, on the needle. And so it's, that would trigger the reward system in my brain, okay? And so that, when you think about that compulsion, who in their right mind would do that, right? And so that craving, that compulsion, that loss of control that begins to happen, we know then that we've kind of moved along that spectrum into severity. And then we continue to use despite negative consequences, adverse consequences. And there are a lot of them. And it's interesting because we have a lot of women in the audience here. When we look at addiction with women and men, there are some differences in addiction with women and men. Women, and men process things a little bit differently, but also addiction is kind of oftentimes hidden with women, particularly if the woman is not working outside the home. But women will use more at home and in relationship with somebody else. And men, tend to be, it's a social thing and then kind of becomes an at-home thing. But with women, it stays hidden quite a bit. So despite the adverse consequences of car accidents or getting your license taken away, getting your children taken away, losing your job, those kinds of things, people will continue to use. And the rational brain is saying, what is wrong with them? Why are they continuing to use? But that's the compulsivity of the addiction and the loss of control of the addiction. And so it's all about this pleasure principle, okay? And we're seeing a lot of sex addiction. How many of you knew that Nashville was the headquarters for Sex Addicts Anonymous? Mm-hmm. Yeah, and sex addiction is becoming huge because, and what we're seeing is that children are being exposed and can access pornography very easily on their phones and on computers and things like that. And when, what we know too is that the younger a person is when they start, the greater the chance of them becoming, having a problem, becoming addicted. And so you've got young children, when we ask that question, do you use pornography? And so many of the young people, both the men and the women, will say yes. Well, how old were you? Many of them are exposed to it by, parents or older siblings when they're 5, 6, 7, 8 years old. And so they're being, and sometimes it's violent. And, so again, that is kind of reorganizing the brain and makes it difficult because then you're upping the ante. Again, you kind of build a tolerance. Most of you probably know, that once you do something over a period of time, you're going to build a tolerance up for it. So it takes more to get the same or the desired effect. And it's why, we end up seeing people doing more and more risky behaviors, prostitution or, near asphyxiation and things like that. And, those kinds of, again, it's about that pleasure principle and the reward center of the brain. I need more, more, more. Do you want to say anything about that? I had to tell y'all, Lee did a sweat lodge this morning with our men in our program.
No, I spent 2.5 hours in like 180-degree sweat lodge today.
Yeah, so he told me, he said, my brain is fried. I don't know how much help I'm going to be here.
A lot of what all of these behaviors and all these situations, what they feed into is that I've never met a person. I've worked for 18 years in the treatment business. I've literally worked with and heard thousands of people's stories in that time. And I've never had anybody say, when I was 15, I decided I wanted to be a junkie. Or I decided I wanted to be an alcoholic, and so I drank really hard for the next 10 years, to where it just was completely out of control. That's not what happens. Mm-hmm. What happens is we're trying to find ways to cope with the discomfort. in our own body and in our own skin. You know what that's like? Like to not feel good enough, to not feel smart enough, to not feel, just not, either you don't want to feel what you're feeling, or you feel like you're completely separate and apart from everyone and everything else. It's very typically human. It's not abnormal, it's typical. So a lot of these behaviors develop as a response or a reaction to life, and then we find relief in something, and so we keep going back to it, which is natural, right? If you like mashed potatoes, you're going to get mashed potatoes every time they're on the plate or every time they're offered. You know, if you don't feel good about yourself and you can go have a couple martinis and all of a sudden you're bulletproof and everything's fine and I go home and go to sleep now, well, then you're going to go have a couple martinis. Well, if you do that for 10 or 15 years, you may not be able to go home without having a couple martinis, and you don't know at what point the switch flipped. You know, it's like we own ourselves up until a certain point in our lives, and then all of a sudden, our behaviors own us. We don't own them. You understand the difference? You ever been in a relationship where like you were right on top of it and it was great, or a job? A relationship can be a job, it can be personal, and you were all engaged in it and it was great and everything was rolling along, and then over a period of time you wake up one day and you're like, what's going on here? I don't really like this anymore. I don't really like myself anymore. What am I doing? You ever been there? You know, we don't know at what point things shift. Well, that's what happens with a lot of people, the majority of people in these behaviors, is we're just seeking some form of comfort. Or we're trying to medicate some form of disconnection and dis-ease, you know, in our own self and our own life.
And in that pleasure principle too, and this is why, you know, there's even a conversation about gateway drugs, is that in that pleasure principle, the quicker you get that surge of dopamine in your brain, the greater the addictive principle. And it's why you'll see people start out drinking a little bit, then maybe they, you know, decide to smoke weed. And actually, when we talk about gateway drugs, nicotine is a gateway drug. And, you know, kids that are using nicotine products, they tend to smoke long periods of time. Almost, what would you say, 85% of people, 90% of people that we see in treatment smoke nicotine products. And it's interesting because the whole vape thing, you know, and not to offend anybody that may be vaping, because it certainly, you know, has some improvement over, you know, smoking, you know, putting cigarette smoke in your lungs. But still, nicotine is the addictive substance. And so you still have that addiction to that nicotine. And I did a research paper, that's how long I've been interested in this stuff, and when I was in junior high school, 8th grade. And I did a research paper on heroin addiction and nicotine addiction. And the research showed that quitting nicotine and staying quit from nicotine was harder than quitting and staying quit from heroin. I mean, that's how powerful it is. And so, you know, you don't see anybody going around, you know, injecting nicotine in their veins, but still, you know, patches and things that, you know, transdermal.
There's not a lot of difference if you're chain smoking cigarettes, and you may as well go ahead and find the vein.
Yeah. So, but that's why people will go from, you know, they'll take pills, you know, pain medication, they'll take the pills, and pretty soon you take enough of the pain pills and you get, you know, you get a little bit of a numb, but then you start hearing people talk about, oh yeah, well if you crush them up and snort them, it's a faster route to the pleasure center, and boy, then if you cook it up and inject it, it's even quicker route to the pleasure center. So that's kind of what happens in that progression. And again, it's about the brain, you know, continually seeking the pleasure, and why people will sit there with a needle in their arm, you know, and you're thinking, how did I get here? How did I get so far down the road here? So we talk about the brain's reward center, and one of the things that at our center, we use nutraceuticals, and we talk with people, we educate them about nutraceuticals, amino acids, and Ken Blum, who is a friend of Lee's, is a psychologist, research psychologist, who's been doing addiction research for over 40 years now. And he has developed a product, Synaptogenix, which was in pill form, and now Synaptamine, which is a liquid form, and the formula is a little bit stronger. But what we know is that if we can get somebody's brain balanced a little bit quicker, the likelihood of them staying in treatment is higher. And so, and again, I'm not going to bash Big Pharma in case there's anybody in here that works for a pharmaceutical company.
I will.
He's my alter ego. He'll say the things that I won't say. But prescribing somebody a pill treats a symptom, and being able to, nutrition is an important part of our program, massage, yoga, breath work, body work, those kinds of things. But the nutrition piece and the nutraceuticals, we talk with people right when they come in and encourage them. The other thing that we do is the genome testing. And if you don't know about that, it's just a mouth swab, and you get a report back that tells you it's red, yellow, or green. And if certain medications are in the red zone for you, our practitioner doesn't prescribe them, because your body is not going to process those medications very effectively. So it's a way of being able to be more precise if we do prescribe medication. And we're not anti-medication. There are some people that need that medication then. But we really try to work with them and help our clients understand how important nourishing the brain is. And if we can really get the brain back in shape, and the gut, we teach them about the gut brain, and the importance of nutrition, and really how much more important the gut brain is than your brain is. And Lee's wife is a chef, and her sister does cooking with our clients, and we teach them how to cook using fresh foods, and not just organic, but a lot of organic. But really, it's more about fresh foods, so that they can begin to understand that there are things out there that don't come in a box or a bag or the freezer.
The best food doesn't require a factory to make it. You know what I'm saying? The interesting thing about brain chemistry is that our brain does not naturally rebalance itself in any kind of a quick time frame. And what I mean by that is, if you've drank alcohol and you've eaten a lot of fast food, and you smoked your share of pot, and a lot of the issues that are really epidemic in our culture, that you run into depression and moodiness, and just a lot of the anxiety, a lot of the issues that we suffer from culturally are actually directly relatable to our diet, to the stuff we're eating and the stuff we're drinking. And so unless you directly and intentionally use something like a nutraceutical, which is just amino acids, it's amino acids and it's vitamins and minerals and amino acids. Amino acids are the precursors to the development of dopamine and serotonin. So unless you're intentionally rebalancing the brain with actual amino acids, and pharmaceutical drugs do not do that. Depression medications basically fake the brain into a sense of rebalance, but that's why so many medications that are prescribed for depression or mood disorders, you're always trading or changing or shifting your medication, because it'll work for a while and then it stops, and you have to go to another one, and it works for a while and it stops. The majority of those issues can be addressed by using nutraceuticals, because it actually literally will allow the brain to rebalance itself, which is pretty amazing. And what Ken learned in this is that compulsive overeating causes the same relationship in the brain chemistry. So most people that would like to get on a diet to lose weight, it's going to be more effective if you take nutraceuticals and rebalance your brain chemistry, because it eliminates cravings for sugar and fat. Because that's what the brain is craving sugar and fat and you think you just want a candy bar. Well, it's your brain, you know?
Still up
It's
here,
wanting a
but-
little buzz off of that high fructose corn syrup. So it's interesting because what we have learned, the longer we've been studying this stuff and paying attention to human beings, what we've seen is that it's really all related, and it's all interrelated. It's all connected.
Do you need to restart it, maybe?
Anybody have any questions or observations or? Yeah. Well, we have them available at the Integrative Life Center. Our offices are on 16th Avenue, right in the middle of the row at Edge Hill. I think you can find, what's the name?
Online, New Pathways, NUPATHWAYS, New Pathways
Yeah.
is one of the websites.
So Google it, and you'll find it. And if you take it, they have like vitamin packs to accompany it. If you take it for a full course, like take it for a full 30 days. A lot of times what happens with people is our brain chemistry is so altered, and it's been so altered for years and years, that it feels normal to us. Like, you know, we don't know what having a balanced brain feels like because we haven't had one forever. So when you start taking it, people will sometimes actually go through a detox like feeling. Like you'll feel weird, you'll feel high, you'll just feel off. Keep taking it, and you'll come out the other side in 4 or 5 days or a
Okay,
week.
now it's back up.
And it's
Thank
just like somebody turned the lights on. It's amazing. It's one of the most beneficial discoveries, in my opinion, around all the addictions work. You know, if you've ever been around 12-step meetings, in the old days you'd go to an AA meeting, and there are these crusty old characters that are, you know, just kind of grouchy and bitch, and you know, but they're cool and they're kind of wise, but you don't really want to hang out with them all the time. They're not a lot of fun. Well, it's because their brain chemistry has never rebalanced. They've been sober for 20 years, you know, but they're just not a lot of fun. And that's where it came from. And so that's what motivated David Miller, the man that really came up with this realization and started working with Ken Blum. These guys, David realized, I've been sober 10 years, and I'm still a grouchy, irritable jackass, you know, and I don't have any patience, and what's the matter with me? Because I didn't used to be like this before I drank for 20 years, right? So he started taking the nutraceuticals, and his entire perspective on life and the way he felt in his body completely changed. And it changed over a couple weeks. So if it's going to work for you, and it works for a lot of people, it's really amazing. Yeah.
So do you already have to be detoxed before you take this, or is you kind of detox, you take this away in the process of detox?
Well, nutraceuticals don't do you any good if you're going to have a couple drinks and snort a line of Coke in the evening. I mean, if that's what you need to get your system clean for it to be able to have an effect. Now, it doesn't hurt you to take them if you're drinking, if you're putting other drugs in your system. There is no, and this is interesting, they just recently really came to this conclusion that there's no, what do you call it,
Contraindication.
Yeah, there's no contraindication between pharmaceutical drugs and the nutraceuticals. They thought for a while that you had to get off of the pharmaceutical drugs if you were on a mood stabilizer or whatever, that you had to get clean off of that before the nutraceuticals could work, and that's not true. So you can get on the nutraceuticals if you are on a pharmaceutical medication, and then slowly titre yourself off of the pharmaceutical medication, and it will still have the same effect. Yeah.
You mentioned amino acids. Is that something to do with the nutraceutical?
Yeah, the nutraceuticals are made up of amino acids. And amino acids are precursors to the dopamine and serotonin production in the brain. Yes?
If you were taking these nutraceuticals and relapsed on the Dr. Pepper or Reese's cup, would it have any effect on you?
It'll probably kill you. No, it won't have a negative effect on you.
But what will happen is that because your brain, is balancing, getting balanced, is that it reduces craving. And I had a client of mine who, alcoholic, and was not able to drink primarily because he had an ankle bracelet on, and he, made a commitment that he wasn't going to do because he had a professional license that he didn't want to lose. And so he was still craving. And this was a young man who actually got through law school shooting heroin twice a day. And not a, crappy law school, but a good law school, not here in Tennessee. But he shot heroin twice a day through law school, and then he was able to quit heroin, but he started drinking quite a bit, and then had gotten a series of DUIs, and through the court system, the court said, okay, you've got to join the monitoring program and wear this ankle bracelet and stuff like this. And he came in and he was continuing to have alcohol cravings. And so I suggested to him that he take a look at the nutraceuticals and start using the nutraceuticals. He also has ADD, okay? And he came in, and it was about 3 weeks when I saw him the next time. Completely different presentation. His body was more quiet than I've ever seen it because he has the ADHD with the hyperactivity. And he, and I said, how are you doing? And he said, I feel so much better. And not only do I feel like I can focus more, I'm not craving alcohol, and I've lost weight. He said, I'm not focused on eating all the time anymore. And weight was not ever a problem for him. We had never even talked about food. And he had never even said anything about, I am hungry all the time and all I can think about is food. And so, and it was the balancing of the brain through the nutraceuticals, and he swore by it from there on out. One of the things in the addiction field that we're taught about is this idea of post-acute withdrawal syndrome, PAWS. And somebody can have, symptoms for, 18 months after they stop using. And part of that, I had a young man, he was 27 when he came to see me, and he had been a heroin addict, and his last, finally got him into treatment was he had died on the operating table. He had died when they took him to the emergency department. And he ended up being in intensive care. They were able to shock him, back. But it was a horrific experience for him. And when he came in to see me, could hardly string a word, a sentence together. I mean, he still had a hard time thinking, and he had been clean about 12 months by the time I started seeing him. And he still was very challenged in, thinking through things, and, just wasn't real quick on the draw there. And so we got him started on the nutraceuticals as well. And the other thing is that he started doing yoga, and he started doing meditation. And because this young man had a history of trauma, which the vast majority of the folks that have addiction have trauma histories. Morton Downey Jr. or Robert Downey Jr. as one of those folks that, has talked about some of that. But this young man, when we got him on the nutraceuticals, it was amazing how clear his thinking became, fairly quickly. So, it's not like a miracle drug or anything like that. You still have to do the psychosocial work with somebody. But it certainly, once the brain, starts balancing and a person can really begin to think and make sense of things, I think it makes a huge difference.
And it can be a very effective alternative for kids rather than putting them on Adderall. Mm-hmm. When you put kids on Adderall, you're setting them up big time. And there's a direct correlation if you look at the introduction of high fructose corn syrup and processed foods starting in the early 80s. and coming up to today, that the explosion of ADD and ADHD
Yeah.
in our culture over the last, 30 years, it's a direct correlation, like the arcs are just side by side with the introduction of high fructose corn syrup in processed food. So is there a direct relationship? You know, I don't know, but it's pretty hard to not believe that there is a connection there.
Yeah. Robert Downey Jr., I think most people know he is in recovery. I love this. The first time I ever heard this was my son actually said that to somebody one time when they were asking him why he didn't drink. And he said, I have an allergy to alcohol. I break out in handcuffs. And I share that story because, again, it's that illustration of the genetic, biological component of addiction. And this is a young man who grew up, you know, knowing about recovery and experiencing recovery, and could stand up there and give a chemical dependency 101 lecture, you know, to any kind of professional group around that. But it's also, he was a young man at 15 and a half, really struggled to get connected in school. We had lived overseas. From the time he was 3 until middle of 7th grade. We moved back here. He went into Brentwood Middle School. It was a very difficult adjustment for him. And the only kids that would give him any attention were those fringe kids that were already smoking weed and, you know, kind of disengaging from school. And my son is a very bright young man. But so really from the time he was 15 and a half till he was 23 years old, he, you know, medicated using alcohol and other drugs, and at 23 decided, with the help of the Davidson County judicial system, that he didn't want to live his life that way anymore, and made that decision to stop drinking and stop drugging. And it's interesting because he is a young man who, you know, his belief is that, you know, he said, I think I could have done it without going to treatment, but I'm glad I went to treatment. And so treatment is not always the answer for people either, and you'll see people who've gone through treatment 4, 5, 6, 10, 12 times. And so treatment, you know, it's not just about the treatment too, it's really, you know, it's about the person and motivation and readiness to change. So we work with that as well in helping people become motivated. So there's a learning process, okay, that one goes through to kind of go along this spectrum. And I believe that they downloaded these slides, so if you want a copy of these slides, you're more than welcome to have them. But there's a process whereby the brain system begins to reward related learning. And again, you know, as Lee said, when you experience something pleasurable, we want to go back to that time and time and time again. And so the reward circuit in the brain includes those areas involved with motivation and memory, again, which is why a lot of people will say, oh, I don't have a problem, I don't need to go to treatment. And again, it's because that part of the brain is being hijacked, okay? So reward and memory, as well as the motivation piece of it. So we know repeated exposure, you know, to the addictive substance, you know, has a major impact on what that person does and how frequently that person does that. So over time, what begins to happen is that we develop tolerance, okay? And so once that tolerance is developed, I'm going to want more. My brain is saying, give me more, give me more, give me more. And again, it's why somebody may start with shooting cocaine, and then they, you know, may start doing speedballs, cocaine and heroin. Then they may start doing heroin. Then they may start doing meth because they're can't afford heroin, and meth is pretty cheap, and it's a very quick high, and you know those. So again, it's about getting more and more and more, and you know that every time we do it, we have to do more because we've developed a tolerance to that. I thought this comic was hysterical. This comic says, "What exactly is in the painkillers they gave you?" I can't read the label because I'm a hologram. And if you've ever been around folks who are high, you know, the ridiculousness of what people experience, being a hologram, is, you know, is part, I know, see, he gets it, is part of that, and that becomes part of that reward center. And I remember I was sharing my story in a group, a women's group for a friend of mine, and they were not alcoholics or addicts, and I was sharing my story, and I was kind of laughing about some of my experiences. And this woman asked me at the end of it, she was like, "Why are you laughing?" And I said, "Well, it's really kind of absurd, the things that I did. You know, I couldn't even imagine or think of doing this." And she looked at me, she goes, "That's the saddest story I've ever heard." And yeah, and when I thought about it, it was a tragic story. But at the same time, you know, because I was getting rewarded time and time and time again for doing what I was doing and bumping up what I was doing and doing more and doing different, you know, it's just, we just don't even think about that. So the compulsion begins to take over, and this is where the loss of control comes into play. And I appreciate you guys hanging in there with us. So the compulsion takes over. Okay, and the learning process mentioned earlier comes into play here as well. Through the brain, the hippocampus and the amygdala store the information, okay, about all of these things, the environmental cues associated. And one of the things that is interesting about that is there was a study that was done with cocaine addicts, and they wired their brain up and measured, you know, brain signals, and they sat them in front of, I think it was the movie Traffic with Catherine Zeta-Jones, and is it Johnny Depp that's in that? Yeah. I mean, it's about cocaine, you know, the cocaine smuggling business. And these are people, cocaine addicts, who had been in clean for quite some time. And even just watching the movie, their brain was lighting up watching the movie, even though, you know, they said, "No, I don't really have a craving," or, you know, "This is not triggering me," but the brain was still responding to watching what was going on in there. So the memory of that was very interesting. So looking at who, and as Lee said, you know, the statistics for death related to opiate use is a little bit different than kind of who is abusing those drugs. And we see this age group, you know, kind of that 18 to 27, 30-year-old age range. And these are kids who are using lots and lots of opiates. We have, I've had a young woman that I worked with and this has been quite some time ago, and she called me most recently, and she has not been able to stay clean. And this is a really bright young woman, and she was on her way to court, and she had a horrible car crash, and, you know, the jaws of life, and life flighted to Vanderbilt. And she was in tears saying, "Holly, why can't I stop? Why, after all of this, do I still crave this drug? Why do I do that?" And it's interesting, there were studies done too with Vietnam veterans who came back, and, you know, a large number of our soldiers in Vietnam used heroin. It was easy to get over there. They were, you know, smoking it or injecting it. And, you know, and we, you know, the United States, the government thought that we were going to have a huge heroin addiction problem when these soldiers were coming back. The majority of soldiers who used heroin overseas in Vietnam stopped when they came back. And there were those that didn't. There were those that continued to use, that were addicted. And again, more evidence that this is a brain disorder and not just about the drug. So, common characteristics, you know, you guys probably know this. I just wanted to put this in there so that you kind of got your CEUs for that. And, you know, we see unusual behavior in there, assertive personality. A lot of times these are the folks that are going to make drop-in appointments, that last appointment of the day, I'm from out of town. They're going to go to a dentist that, you know, I'm in pain right now. Can't you just give me a prescription for 10 Vicodin? And yes, I'll make an appointment. I'll call tomorrow. Or my dentist is at, you know, those kinds of things. So they're pretty common things that we can take a look at and look for. And so not just for yourselves, but your folks that are working, you know, your reception desks, they can be your eyes and ears in that waiting room as well. And doctor shopping is one of those things that, that happens frequently. And I remember my sister, when she moved here, I found just this stash of medications, and they were from 4 different doctors. And she, she was so good at talking and convincing the doctors about her pain. I mean, they would give her 90 Soma at a time. And I mean, and this was just, a couple of years ago. This is not like 10 years ago when there was not as much awareness. But, and I can remember too having a dentist, and I love my dentist. Ken Robertson is my dentist, and he is so good. But I can remember having dentists. I have had a ton of dental work done. I have put more dentist kids and orthodontist kids through college, I'm sure. But I have had dentists where I've had crown work done, root canal and crown work done, and they have insisted on writing me prescriptions for Vicodin. It's really not that painful, for me. And I would say, I don't take pain medication. No, but you might need it. Well, I can take ibuprofen if I need it. No, you need to take this. Well, can you give me something different? No, I prescribe Vicodin. I mean, literally, the guy wrote the prescription and, made me take it. And I thought, okay, I'm not going to argue with him anymore. And I just tore the prescription up, when I walked out. But it was that, forceful. That, and in our culture, as Lee was saying, this tends to be a cultural thing at times too. In our cultural, pain has become a bad thing. We should be pain-free, and pain is not necessarily a bad thing, right? I mean, dry sockets for wisdom teeth are really painful, and we may need something for that. But for the most part, most procedures, even if somebody is, on the roof, the pain, to teach people, about, how to redefine pain, or breathing techniques, or, a lot of dentists have televisions in there now too. Bringing headphones, having headphones with soft music can really be helpful too. I don't know if any of you do that in your practice, but there are some things that we can teach patients that help them get through a procedure. Were you going to say something? No? Okay.
Yeah. If you've ever worked around pain management, I started a treatment program in Malibu about 10 years ago, and our doc is a pain management specialist and an addictionologist. So we had quite a few clients, I call them clients instead of patients, that had chronic pain issues, and they had gotten addicted to their medications, of course, over time. And the interesting thing about opiates and pain medication is that over a long period of time, the opiates and the pain medications make the individual hypersensitive to pain. Mm-hmm. So you're feeling pain that is the result of the medication. Mm-hmm. And it's really a trap. I mean, it's terrible, because they did have some sort of chronic pain that was legitimate, but after taking opiates for 5 or 6 years every single day, they get hypersensitive to where, their skin hurts. And it's really interesting. It's really daunting. And our culture truly is absolutely, and y'all know this, people just freak completely out over something hurting for a few minutes. To me, pain is like a sign that you're still alive. But it's really interesting. And so, in a lot of instances where you could give somebody 3 days worth of Vicodin, they don't need 10 days worth of Vicodin to have a wisdom tooth pulled. I mean, I'm not telling you guys what to do, but it's been over the top because the pharmaceutical industry has done such a good job of convincing doctors that they're not being responsible in their practice if they're not just loading everybody up with pain meds. And then they get to come see us 5 years later when their life's melted down.
I love this definition by Alice Miller of addiction, and it's not a medical definition by any means, but she says, What is addiction really? It's a sign, a signal, a symptom of distress. It is a language that tells us about a plight that must be understood. And if you're interested in reading more kind of about this approach to addiction, Gabor Mate, M-A-T-E, is a Canadian psychiatrist he wrote a book called In the Realm of the Hungry Ghost. And it was a pretty provocative read, in the beginning when people began reading what he said, but he also believes that addiction is the result of trauma and disconnection. And that's what Alice Miller is saying right here. And there's a gentleman, and I'm going to show this YouTube clip or TED Talk about, and this concept of the opposite of addiction is connection. And this is really what treatment is about. In many of our treatment centers now is about helping people connect. And it's one of the reasons why 12-step community, 12-step recovery took off, because alcoholics and addicts were so isolated and lonely. And once they began forming and gathering in community, with people who didn't look at them with disgust, and people who were not judging them, and people who were not closing the door in their face. I mean, the shame and the stigma around addiction is still very strong in our culture. And so, to be in a community of people who, totally get you and are not judging what you're doing or how you're doing it has been really, really important. So I am going to play this.
One of my earliest memories is of trying to wake up one of my relatives and not being able to. And I was just a little kid, so I didn't really understand why. But as I got older, I realized we had drug addiction in my family, including later cocaine addiction. And I've been thinking about it a lot lately, partly because it's now exactly 100 years since drugs were first banned in the United States and Britain, and we then imposed that on the rest of the world. It's a century since we made this really fateful decision to take addicts and punish them and make them suffer, because we believed that would deter them, it would give them an incentive to stop. And a few years ago, I was looking at some of the addicts in my life who I love and trying to figure out if there was some way to help them. And I realized there were loads of incredibly basic questions I just didn't know the answer to. Like, what really causes addiction? Why do we carry on with this approach that doesn't seem to be working? And is there a better way out there that we could try instead? So I read loads of stuff about it, and I couldn't really find the answers I was looking for. So I thought, okay, I'll go and sit with different people around the world who've lived this and studied this and talk to them and see if I can learn from them. And I didn't realize I would end up going over 30,000 miles at the start, but I ended up going and meeting loads of different people, from a transgendered crack dealer in Brownsville, Brooklyn, to a scientist who spends a lot of time feeding hallucinogens to mongooses to see if they like them. It turns out they do, but only in very specific circumstances. To the only country that's ever decriminalized all drugs, from cannabis to crack, Portugal. And the thing I realized that really blew my mind is almost everything we think we know about addiction is wrong. And if we start to absorb the new evidence about addiction, I think we're going to have to change a lot more than our drug policies. But let's start with what we think we know, what I thought I know, right? Let's think about this middle row here, right? Imagine all of you, for 20 days now, went off and used heroin 3 times a day. Some of you look a little bit more enthusiastic than others at this prospect. Don't worry, it's just a thought experiment. Imagine you did that, right? What would happen? Now, we have a story about what would happen that we've been told for a century. We think because there are chemical hooks in heroin, as you took it for a while, your body would become dependent on those hooks, you'd start to physically need them, and at the end of those 20 days, you'd all be heroin addicts, right? That's what I thought. First thing that alerted me to the fact something not right with this story is when it was explained to me, if I step out of this TED Talk today and I get hit by a car and I break my hip, I'll be taken to hospital and I'll be given loads of diamorphine. Diamorphine is heroin. It's actually much better heroin than you're ever going to buy on the streets, because the stuff you buy from a drug dealer is contaminated, actually very little of it is heroin, whereas the stuff you get from the doctor is medically pure. And you'll be given it for quite a long period of time. There are loads of people in this room who may not realize that you've taken quite a lot of heroin, right? And anyone watching this anywhere in the world, this is happening. And if what we believe about addiction is right, those people are exposed to all those chemical hooks. What should happen? They should become addicts. This has been studied really carefully. It doesn't happen. You will have noticed if your grandmother had a hip replacement, she didn't come out as a junkie. And when I learned this, it just seemed so weird to me, so contrary to everything I'd been told, everything I thought I knew. I just thought it couldn't be right. Until I went and met a man called Bruce Alexander, who's a professor of psychology in Vancouver, who carried out an incredible experiment that I think really helps us to understand this issue. Professor Alexander explained to me, the idea of addiction we've all got in our heads, that story, comes partly from a series of experiments that were done earlier in the 20th century. They're really simple experiments. You can do them tonight when you go home if you feel a little bit sadistic. You get a rat and you put it in a cage, and you give it 2 water bottles. One is just water, and the other is water laced with either heroin or cocaine. If you do that, the rat will almost always prefer the drugged water and almost always kill itself quite quickly. So there you go, right? That's how we think it works. In the 70s, Professor Alexander comes along and he looks at this experiment and he noticed something. He said, we're putting the rat in an empty cage. It's got nothing to do except use these drugs. Let's try something a bit different. So Professor Alexander built a cage that he called Rat Park, which is basically heaven for rats, right? They've got loads of cheese, they've got loads of colored balls, they've got loads of tunnels. Crucially, they've got loads of friends, they can have loads of sex, and they've got both the water bottles, the normal water and the drugged water. But here's the fascinating thing. In Rat Park, they don't like the drugged water. They almost never use it. None of them ever use it compulsively. None of them ever overdose. You go from almost 100% overdose when they're isolated to 0% overdose when they have happy and connected lives. Now, when he first saw this, Professor Alexander thought, maybe this is just a thing about rats. They're quite different to us, maybe not as different as we'd like, but, But fortunately, there was a human experiment into the exact same principle happening at the exact same time. It was called the Vietnam War. In Vietnam, 20% of all American troops were using loads of heroin. And if you look at the news reports from the time, they were really worried because they thought, my God, we're going to have hundreds of thousands of junkies on the streets of the United States when the war ends. It made total sense. Now, those soldiers who were using loads of heroin were followed home. The Archives of General Psychiatry did a really detailed study, and what happened to them? It turns out they didn't go to rehab. They didn't go into withdrawal. 95% of them just stopped. Now, if you believe the story about chemical hooks, that makes absolutely no sense. But Professor Alexander began to think there might be a different story about addiction. He said, what if addiction isn't about your chemical hooks? What if addiction is about your cage? What if addiction is an adaptation to your environment? Looking at this, there was another professor called Peter Cohen in the Netherlands who said, maybe we shouldn't even call it addiction. Maybe we should call it bonding. Human beings have a natural and innate need to bond. And when we're happy and healthy, we'll bond and connect with each other. But if you can't do that because you're traumatized or isolated or beaten down by life, you will bond with something that will give you some sense of relief. Now, that might be gambling, that might be pornography, that might be cocaine, that might be cannabis, but you will bond and connect with something because that's our nature. That's what we want as human beings. And I think, at first I found this quite a difficult thing to get my head around, but one way that helped me to think about it is, and I can see, I've got over by my seat there a bottle of water, right? I'm looking at lots of you, and lots of you have bottles of water with you, right? Forget drugs, forget the drug war. Totally legally, all of those bottles of water could be bottles of vodka, right? We could all be getting drunk, I might after this. But we're not, right? Now, because you've been able to afford the approximately £1 gazillion that it costs to get into a TED Talk, I'm guessing you guys could afford to be drinking vodka for the next 6 months. You wouldn't end up homeless. You're not going to do that. And the reason you're not going to do that is not because anyone's stopping you. It's because you've got bonds and connections that you want to be present for. You've got work you love. You've got people you love. You've got healthy relationships. And a core part of addiction, I came to think, and I believe the evidence suggests, is about not being able to bear to be present in your life. Now, this has really significant implications. The most obvious implications are for the war on drugs, right? In Arizona, I went out with a group of women who were made to wear T-shirts saying I was a drug addict and go out on chain gangs and dig graves while members of the public could jeer at them. And when those women get out of prison, they're going to have criminal records that mean they'll never work in the legal economy again. Now, that's a very extreme example, obviously, in the case of the chain gang, but actually almost everywhere in the world we treat addicts to some degree like that. We punish them, we shame them, we give them criminal records, we put barriers between them reconnecting. There was a doctor in Canada, Dr. Gabor Mate, an amazing man, who said to me, if you wanted to design a system that would make addiction worse, you would design that system. Now, there's a place that decided to do the exact opposite, and I went there to see how it worked. In the year 2000, Portugal had one of the worst drug problems in Europe. 1% of the population was addicted to heroin, which is kind of mind-blowing. And every year, they tried the American way more and more. They punished people and stigmatized them and shamed them more. And every year, the problem got worse. And one day, the Prime Minister and the leader of the opposition got together and basically said, look, we can't go on with a country where we're having ever more people becoming heroin addicts. Let's set up a panel of scientists and doctors to figure out what would genuinely solve the problem. And they set up a panel led by an amazing man called Dr. João Goulão to look at all this new evidence. And they came back and they said, decriminalize all drugs, from cannabis to crack. But, and this is the crucial next step, take all the money we used to spend on cutting addicts off, on disconnecting them, and spend it instead on reconnecting them with the society. And that's not, essentially, that's not really what we think of. What they did wasn't really what we think of as drug treatment in the United States and Britain. So they do residential rehab, they do psychological therapy that does have some value. But the biggest thing they did was the complete opposite of what we do. A massive program of job creation for addicts and microloans for addicts to set up small businesses. So say you used to be a mechanic. When you're ready, they go to a garage and they'll say, if you employ this guy for a year, we'll pay half his wages. The goal was to make sure that every addict in Portugal had something to get out of bed for in the morning. And when I went and met the addicts in Portugal, it's fascinating. What they said is, as they rediscovered purpose, they rediscovered bonds and relationships with the wider society. It'll be 15 years this year since that experiment began, and the results are in. Injecting drug use is down in Portugal, according to the British Journal of Criminology, by 50%, 50%. Overdose is massively down. HIV is massively down among addicts. Addiction in every study is significantly down. One of the ways you know it's worked so well is that almost nobody in Portugal wants to go back to the old system. Now, that's the kind of political implications. I actually think there's a layer of implications to all this research below that. You know, we live in a culture where people feel really increasingly vulnerable to all sorts of addictions, whether it's to their smartphones or to shopping or to eating. You know, before these talks began, you guys know this, that we were told we weren't allowed to have our smartphones on. And I have to say, a lot of you looked an awful lot like addicts who were being told their dealer was going to be unavailable for the next couple of hours. And yeah, a lot of us feel like that. And it might sound weird to say, oh, you know, I've been talking about how disconnection is a major driver of addiction. But weird to say it's growing because you think, well, we're the most connected society there's ever been, surely. But I increasingly began to think that the connection we have, the connections we have, we think we have, are like a kind of parody of human connection. If you have a crisis in your life, you'll notice something. It won't be your Twitter followers who come to sit with you. It won't be your Facebook friends who help you turn it round. It'll be your flesh and blood friends who you have deep and nuanced and textured face-to-face relationships with. And I think there's a study I learned about from Bill McKibben, the environmental writer, I think tells us a lot about this. It looked at the number of close friends the average American believes they can call on in a crisis. That number has been declining steadily since the 1950s. The amount of floor space an individual has in their home has been steadily increasing. And I think that's like a metaphor for the choice we've made as a culture, right? We've traded floor space for friends, we've traded stuff for connections, and the result is that we are one of the loneliest societies there has ever been. And yet, Bruce Alexander, the guy who did the Rat Park experiment, says, we talk all the time in addiction about individual recovery, and it's right to talk about that, but we need to talk much more about social recovery. Something's gone wrong with us, not just as individuals, but as a group. And we've created a society where, for a lot of us, life looks a whole lot more like that isolated cage and a whole lot less like Rat Park. But if I'm honest, this isn't why I went into it, right? I didn't go in to discover the political stuff, the social stuff. I wanted to know how to help the people I love. And when I came back from this long journey and I'd learned all this, I looked at the addicts in my life, and if you're really candid, it's hard loving an addict, and there's going to be lots of people who know in this room you're angry a lot of the time. And I think one of the reasons why this debate is so charged is because it runs through the heart of each of us, right? Everyone has a bit of them that looks at an addict and thinks, I wish someone would just stop you. And the kind of script we're told for how to deal with the addicts in our life is typified by, I think, by the reality show Intervention. If you guys haven't seen it, I think everything in our lives is typified by reality TV, but that's another TED Talk. If you've never seen the show Intervention, it's a pretty simple premise. You get an addict, all the people in their life, gather them together, and say, if you don't shape up, confront them with what they're doing, and they say, if you don't shape up, we're going to cut you off, right? So what they do is they take the connection to the addict and they threaten it. They make it contingent on the addict behaving the way they want. And I began to see why that approach doesn't work. And I began to think that almost that's like the importing of the logic of the drug war into our private lives. So I was thinking, well, how can I be Portuguese, right? And what I try to do now, and I can't tell you I do it consistently, and I can't tell you it's easy, is to say to the addicts in my life that I want to deepen the connection with them, to say to them, I love you whether you're using or you're not. I love you whatever state you're in, and if you need me, I'll come and sit with you because I love you and I don't want you to be alone or to feel alone. And I think the core of that message, you're not alone, we love you, has to be at every level of how we respond to addicts, socially, politically, and individually. For 100 years now, we've been singing war songs about addicts. I think all along we should have been singing love songs to them, because the opposite of addiction is not sobriety. The opposite of addiction is connection. Thank you.
Pretty amazing philosophy, huh? And still, you know, we have treatment centers that are very punitive in their approaches. Families are being trained and taught to cut the addicts and alcoholics out of their lives. And there's a difference between enabling and supporting. We can continue to support somebody who is using without enabling them, making it easy for them to use, making it easier for them to use. And I think that's this message, is being able to continue to love somebody, let them know we love them, support them without enabling, and help them stay connected makes the difference. And it's one of the things that has always been important for Lee in the treatment programs that he has created, is that, if I've heard him say once, I've heard him say it a zillion times, community is important. We've got to create community. We've got to create connection. We have got to let people know that they are loved and that we don't kick them out. In our program, we don't kick people out for using. We will work with them. We will, help them find, we have different levels of care that we can put them in. And so, that it's just philosophically one of the things that was very important to us, is that folks understand that this is a process that we go through, that it takes time and it takes a lot of effort and it takes making mistakes, and but that we want to develop a community so that people begin to feel connected again.
One of the things it's conflicting, I guess, with our culture, is that if someone close to you, somebody in your family, has an issue like that, we don't know how to deal with it. It scares you. It's threatening, But if you really drill down into it, what you realize a lot of times is that the truth is our reactions to that person are simply that that person is not living up to our expectations. They're not being the person that we expect them to be. You understand what I'm saying? So really what happens without us even really understanding it is that we're judging that person for the situation that they're in, for behaving the way they're behaving, rather than extending ourselves to that person and saying, what's going on? And it's difficult. It's challenging. I'm not saying this is easy, but I'm saying a lot of times, because so much of our culture is based in judgment, and there's so much fear in our culture. There's fear that if I don't make enough money, I won't be okay, and if I don't have the right relationship, then I'll be alone forever, and if I'm not driving the right car, I won't be cool, and if I'm not wearing the right clothes, they won't like me. It's just on and on and on and on. So there's some fundamental, I guess, aspects of how we are programmed growing up as kids that really engage us in an unconscious, automatic judgment of situations that we find uncomfortable or that are not familiar to us. You know, and that's an opportunity for all of us, like he was talking about. If we really drill down into the issues around addiction in this country, what we're going to find is that our entire culture is off the rails. And it's really interesting when you look at that the demands, the expectations, the judgments, the fear. You know, we don't raise our kids by saying to them the whole time they're growing up, who are you? What do you want to do with your life? Who are you? We may say that occasionally, but most of the time we raise our children wanting them to fulfill aspects of our lives that we didn't get to do, or we're wanting them to be what we will be proud of. I have grandkids. You know, I raised two daughters. My oldest daughter is 33. My next daughter is 29. And then I got divorced because I was a crazy man and a miserable person to be married to. And then like 10 years later, I got married again. Well, now I have a 14-year-old and a 10-year-old. So I've had an opportunity to raise two different families. And my experience as a dad, with the awareness that I have today with my two young daughters and the father that I was with my two grown daughters, is completely different because I realized that our children are not our property. They are themselves, right? And that to honor and respect what they are and support them in sorting out their relationship with themselves first, and then their relationship with the world. It allows them to have some confidence and to be proud of who they are, rather than their lives having to be tied to our parental expectations of who they should be. You understand what I'm saying? Because they're fine. They were, wherever we come from, they were created to be who they are. That's my belief. They were not created to be my expectations of them. And who they are is going to be a lot closer to the source of wherever we come from, to God, than anything I could try and project onto them. So it's just a shift. There's a lot of opportunity in all of this for us to really look at the nature of how we live with each other, you know, and with ourselves, y'all, because you'll never meet a judgmental person, someone that judges other people all the time, that's not twice as nasty to themselves. They may not be doing it out in the open, but I guarantee you the voices in their head are a lot harder on them than they are on other people.
Mm-hmm. Yeah.
You have any questions or comments?
I just have something to say. I mean, people are meant to do the stuff that they're not allowed to do. So when we tell the kid, like your child, you're not going to eat candy, whenever you go to the bathroom, they're going to go and get it secretly. You can't use your phone, they're going to do it. So the way the family raise their kids, like how you're not allowed to take drugs, you're not allowed to drink, then when they grow older, they're going to do it secretly. Like in my culture, they teach us you gotta wear the scarf. But if they force the kid to do it, when they go to school, they take it off. And I know a lot of people, they go to school, they take off. When they come closer to their home, they put it on. So what I mean by that, I've lived in Netherlands for a year and a half. Their drugs is legal. You can go, like how you go to buy cigarette, they have shops for drugs, they have shops for alcohol, and it's legal. You can even get it. Everybody's like allowed to do it. There's nothing that illegal. But they do taxes, they charge taxes maybe twice. People who are addicted, they may not find jobs, but if they do find a job, it will be half of the wages that the other people are working on.
Mm-hmm.
And they have a lot of programs on that. So on this year and a half I lived there, I have never seen people that you can tell, oh, this person is maybe doing something. But here, if I go to Walmart, I can tell many people that they are not. They're doing stuff, but you can tell. When you walk on the street, you can tell.
Mm-hmm.
So I'm thinking because the United States is illegal, so these drug dealers, they wanted more people to be addicted and taking it, and because the more people addicted, they are making money out of that without taxes paying, you know.
Mm-hmm.
And everything is being like that.
Yeah.
So that's why we're getting a lot of patients that they're taking meth because they can't afford to do that. Meth and some other ones that we have is Mountain Dew, I think. That's the worst that we have seen because all their teeth are rotten.
And that's, you bring up a really good point that, restricting things from people is one way, of teaching. It may not be effective for everybody. It may be helpful for some, but not others. And that's where, as Lee said, really being able to look at, each one of us as individuals and what, 4 kids in my family, and my parents really needed to parent all 4 of us very differently because we were very different kids. Some of us were risk takers, others were rule compliant, and everything in between there. So, harm reduction, yes, in European countries, harm reduction has been an approach for ages and ages. It makes people gasp. In the United States, again, this is just cultural differences, makes us gasp here in our country when we talk about needle exchange programs and the effectiveness of, from a public health standpoint of needle exchange programs. So, and it was interesting, when marijuana became illegal, it was really because if you've ever watched these documentaries on YouTube, they're great. Marijuana became illegal because white women were hanging out with African American men smoking weed, and the government, our politicians didn't like it, so they decided to make marijuana illegal. It was a political decision. And the same with opium. White women in San Francisco were going to the opium den with the Chinese who had been brought over to our country to help on the railroad system, and because of that, it was, the politicians said, we don't want our women doing that. We're going to make this illegal. So a lot of this, it's based on control and then punishment. And, what we see over and over is that tends not to be a real effective system. So.
Anybody else? If you have someone in your life that has an issue or could have an issue going on, as uncomfortable as it can be to say something to them, it's really important to tell people, you know what, I just care. Like, the worst thing you can do with a human being who's already in reaction to the world around them and to their life and within themselves, the worst thing you can do is try and tell them what they should do. If you want to see some, it just doesn't work. The most effective thing you can do is let them know that you really care, like he said, and that I care, and you know what? If you need help or you would like to talk about it or there's something I can do to support you, let me know. Now, I'm not saying that you let somebody in your house that's going to steal your jewelry so they can go get a fix, because there's kind of a practical side to it. But it's not, it just doesn't work living in judgment of situations that we don't understand. You can never correct a wrong or a bad situation by going into judgment over it. If you want to correct a bad situation, then it requires that we are willing to sit with it to where we can come to some kind of an understanding so that we can connect to it, then you can change it. You understand what I'm saying? Mm-hmm. And if we have a bunch of folders here, and it's totally cool with us if you want to take them back to your offices, and have them available. I can tell you this, the Integrative Life Center, again, we're over on 16th Avenue. It's as cool and dedicated and funny and creative a group of people as you'll ever run into anywhere. And if we can't help someone, we will find the connection for them. That's the way we operate. And that's what we do. And we really are a community resource here in Nashville. We have an adolescent program, an after-school program. We're getting ready to start up another evening group. We have day programs. We have a residential treatment program that looks like kind of like a Cumberland Heights as far as structure goes. So we have created programming to meet people where they're at, rather than saying, you're wrong, you're sick, you're bad, and you're going to have to do what we tell you to do if you want to get better. We say, look, whatever's eating on you, whatever you got all over you, we can help you unravel that stuff, and let's find a way that can that you can accommodate this in your life. You understand what I'm saying? It's like, we really operate from a place of respect, because you can't get buy-in from people if you disrespect them. You know, it's like you can't say, I'm here to help you because you're sick and wrong. It doesn't work. Energetically, it creates barriers and separation. And what people do need, what we all need in our country, is more community and more connection. We need to have more fun. We need to work less. It's ridiculous. It's out of control. That's just my philosophy.
So we do have folders. As Lee said, we're on 16th Avenue South. You know, please feel free to give us a call. I think Ashley or Lynn's cards are in there, but you can reach any of us through our main number there. If you'd like to come over, take a tour, we would love to show you our center. We would love to show you the residences that we have that are absolutely drop-dead gorgeous, not because we want to attract high-end celebrity clients, but it's because we think people deserve to live in a nice place, in a nice neighborhood while they're trying to get clean and sober. So please come up, take folders. Thank you guys so much for hanging in there with us. This was a late day after sitting all day long. So, you know, thank you so much for being here. We really appreciate that and have enjoyed being here with you.